So Jamie, let me know when you want me to start.
Yeah. Good afternoon, everyone. My name is James Storm with the Benefits Office here with Prince George's County Public Schools. Thank you for attending our virtual information session today. We have Carefirst. Michelle Finney from Carefirst will be presenting. We are recording this session and it will be posted on the benefits webpage in about 48 hours for folks to review. So we ask a couple things: that everyone stay on mute during the presentation, and we will hold questions until Ms. Finney is done with her presentation, and then we will take questions related to the Carefirst benefits, general questions about the benefits. We will not entertain questions if you have personal questions about your explanation of benefits or your benefits or any billing questions. That's something we cannot address today, but we'll certainly address any questions related to the Carefirst benefit with the presentation. So with that, I will turn it over to Michelle, and we will get started.
We will get started. So good afternoon, everyone. I am Michelle Finney. I'm the account manager with Blue Cross and Blue Shield, and I will be presenting the medical benefits today for the Board of Education of Prince George's County. So I am going to go off camera while I do the presentation, but I will be back after the presentation is over. So bear with me one moment. All righty. So this is the open enrollment period for Prince George's County Public Schools. Open enrollment began October 10th. It ends October 26, 2022. So what is open enrollment? This is your opportunity if you are a new member and haven't signed up for insurance. So this is your opportunity to sign up with us now. New dependents that you may have gotten married and wanted to add your spouse dependents to the plan, this is your opportunity to do it as well. Make any changes in coverage, like if you are divorced and want to go to single coverage, and change the number of dependents. So what's new for this year, for 2022? No changes this year. So that's always kind of nice to know that the benefits that you were used to for 2022, there'll be no changes for 2023. So here are the medical plans that we offer today. So we offer the Blue Choice Triple Option Open Access Plan. What does that mean? That means you get 3 health plans in one. So when I'm out meeting with Prince George's school members, they always have the question of, which one should I choose? Should I choose the HMO option 1, the PPO option 2, or the out-of-network option 3? Well, you don't have to decide because you get all 3. And what does that mean? It is based off of your provider. So if you choose an HMO provider under the option 1, your benefits will fall here. There are no annual deductible. Preventive care is covered in full. Your primary care physician copay is $10 for office visit, and the specialist is a $25 copay. You will see under option 1, the benefits are just a little more richer because it's 100% for at network locations for labs and x-rays. If you go to the urgent care center, it's only $15. The emergency room, there is a $150 copay. So I can tell you about 98.5% of members with the Board of Education through Prince George's County, they actually stay under option 1 because there's less out of pocket under the option 1. But you have the option of option 2 in PPO. It does have a $200 individual deductible and $600 for family. Preventative care, again, is covered in full. Primary care physician copay is $20. Specialist copay is $35. This is where it makes it different between the HMO and PPO plan, because under the PPO plan, which is referred to as preferred provider option, that's what PPO means, there's a 20% allowed benefit after deductible. So you will be responsible for an individual $200 to be satisfied, and then we will reimburse at 80% of the allowed benefit. Your responsibility will be 20%. The urgent care copay is a $30 copay per visit if you use a preferred provider option provider. In all emergency rooms, because we know and are aware that most folks, when they're using an emergency room, it's an emergency. So that's always going to be covered under option 1. Option 2 also allows if you were or have a dependent or spouse that you're living or apart, or the dependent is going to college somewhere, they can use the PPO option 2. And this is where they will still have full coverage, even if they are going to school in Colorado, California, Florida, New York. There's still some coverage for your dependent or spouse if they're living apart under the PPO option 2. So what does out-of-network option 3 mean? Because it definitely has a higher deductible of $500 and the family deductible is $1,000. Again, preventative care is covered in full, but again, you see the difference here is there's no copays for primary care or specialists. It's a 30% of allowed benefit, which means Carefirst will provide benefits at 70%, and we will pay 30%. You will be responsible for 30% after the deductible. The urgent care copay is $30, and emergency room, again, is option 1. So what is out-of-network? Out-of-network means you're using a provider that is not a Blue Choice HMO or PPO provider. This is a provider that you've chosen to use that doesn't participate with the plan at all. They are not Carefirst or any Blue Cross participating provider. But this plan also, this part of the plan allows you to have coverage no matter where you are, even outside of the United States, you still have coverage. So that's the important thing about having a triple option plan. It still allows you to use benefits no matter where you are. Hospitalizations, again, has a $150 per admission copay. This is only under option 1. Once you pay that $150 per admission copay, and this is again for hospitalizations, then we pay everything in full. Maternity is covered in full. When you go to have a mental health office visit, it's just a $10 copay. Durable medical equipment is covered in full, and physical therapy has a $20 copay, and home health care is covered in full. And basically under the other 2 options, there is always deductible that has to be satisfied. And then it's either reimbursed at 80%, Carefirst will reimburse at 80%. You will be responsible for 20% and also 30% after the deductible. Making the most of your plan. One of the things that we really try to streamline for the Board of Education members is that we have what we call a microsite. And we actually created this instead of you having to go to carefirst.com, because you have the option to do that. We streamlined the microsite so you can go right to see your information specific to the Board of Education members through PGCPS.com. So this is your microsite address. You can come here and find your plan documents. This houses the contracts between Carefirst and Prince George's School. So if you're looking up for more detailed information, it has those there. It has the SBCs are located here. It has all type of plan documents on your personal microsite. You can also go here to find a doctor. If you're interested in Carefirst video visit, you can come here as well. And your wellness program. It also has information and tips for Board of Education members. My account. which is so important. If you haven't signed up for My Account, please do so. You can go to carefirst.com/my account. Here, you can view your explanations of benefits. So let's say, for instance, you're receiving paper explanation of benefits. You can turn those off. You have the option of doing that and just receive an email from us, and you'll know when your claim has been processed. But this is where you can go if you receive a bill from the doctor and they're telling you that you owe monies and you're really not sure if you owe exactly that amount. You can always come to My Account, retrieve your explanation of benefits, and you'll know exactly how much you owe that provider. I have to emphasize, if you're going to a participating provider, whether they're under option 1 or option 2, and you receive an explanation of benefits and you are owed monies to the provider, please always check your explanation of benefits and make sure that's exactly what you owe the provider. Here, there is still another option of finding a doctor facility. It's for you also to check your benefits. So if you're not really sure what your benefits are, you can also check it under My Account. You can view, order, and print ID cards. And you can always do estimate of medical expenses. We have all kinds of tools to try to figure out, if you're trying to figure out what your out-of-pocket expenses are for major procedures, all of that is housed in My Account. So more ways to save and know before you go. We want everyone to have a personal relationship with their primary care physician. And you know, under option 1, that copay is only $20. So if you're not sure where to go, if you're ill, like my daughter was sick, we were in Florida, wasn't sure where to go, what to do. So I called my free 24-hour nurse advice line because there is no copay for that. That's why there's a 0. You don't even have to worry about jotting down this telephone number, because why? It's on the back of your identification card. So if you're not sure what to do, where to go, even if you're not in Florida, if you're just right here in Maryland, DC, or Virginia, the nurse advice line is always available to you 24 hours a day. Carefirst video visit. So this is something that we've been really talking about as well, because many teachers, or even if you're just faculty staff, sometimes you can't leave your office. And I've done this as well. I just dial a doctor through my laptop or phone. And an interesting story, I had a member that was in Ocean City, fell asleep on the beach, woke up to a horrible sunburn. She just pulled out her phone and was able to dial a doctor. And by the time she left the beach, her prescription was ready. So it's another available option for you. We also have convenient care centers through CVS Minute Clinic. Walgreens even has walk-in clinics that you can use. We also stress for you to use urgent care centers. And the great thing about urgent care centers now is that if you have an accidental injury like I did, you can walk into an urgent care center now and they do all types of x-rays and they put me in a boot and sent me home. So the last resort, if it's always a medical emergency and life-threatening, always go to the emergency room if you're not sure what to do. The copay is $150, but if you have to go, if it's a life-threatening situation, you still have the option to go. Carefirst video visit, just a little bit more about them. So they're available 24 hours, 7 days a week, 365, and you don't need an appointment. So with urgent care, you can do behavior health, diet and nutrition, and breastfeeding support. I always recommend to people to go and sign up for Carefirst video visit now, because when you need it, you don't want to have to fumble and sign up for it, because it will ask a lot of questions through registration. So you need to put in your pharmacy, because your pharmacy is not with Carefirst, it's through CVS. So you need to complete all of that information ahead of time. So when you're ready to use it and dial a doc, as I say, then it'll be available to you and you can get immediate help as soon as you need it. Blue 365. I use them too. So Blue 365 is one of our programs through the Carefirst Association, and they offer all type of discounts on apparel, footwear, hearing, vision. For instance, hearing aids is not a covered benefit under the Board of Education's account. So you may want to go and look through Blue 365, and you do need to register. So make sure you register for that, and they'll be offered you all types of discounts, even on travel. Behavior health. So this is something that everyone is talking about, and it's so important for everyone. If you're really feeling stressed or you just need to talk to someone about any family issues, job issues, we do have what we have called behavioral health support through this telephone number here. They are also available 24/7, and there's also considered a crisis line. So you can reach out to them anytime for any assistance you may need. The beauty of it now is that we have 7 Cups. 7 Cups is a digital support where you can reach out to one of the behavioral health providers. And this way, you can have a relationship with this provider. It is somebody that you can reach out to anytime, and you can always go back and get the same person that you spoke with. Unlike Carefirst Video Visit, you may not always get the same provider every time, but with 7 Cups, you can have the same provider anytime you need it. Just reach out and they will be able to assist you. Our wellness program. So we're trying to make everything digital these days. Your health assessment, personal timeline with wellness recommendation, health content. So all of this can be right at your fingertips by going to your phone, through your laptop. You can go to ShareCare to register. I love ShareCare because I am right now getting health coaching, and I do the health assessment. And this will be a wonderful help just for you to get yourself on track and what you need to do. We have all types of programs out here, even financial well-being tools is through our ShareCare app. Health coaching, that was one of the things that I was talking about. So it's one-on-one with a registered health coach or a registered nurse. They help you set goals and priorities with tips on physical activity, healthy eating. And there's also disease management coaching. So for me, I'm also part of the disease management because I have asthma. So they reach out to me consistently because one of my triggers for asthma is right now when summer is turning into fall and all those nice leaves are falling. So they will call me to say, hey, Michelle, what are you doing to help treat your asthma? Do you have your inhaler? When was the last time you've seen your primary care physician? I love my health coaching. They are tremendous. Looking to lose weight or reduce your diabetes risk? So this is called Scale Back. And Scale Back will allow you, if you sign up for them and your BMI is greater than 25, and if you're pre-diabetic, you can qualify for this program. They will give you a wireless scale, a Fitbit activity tracker, live classes, all type of community support, and easy meal tracking. Spoke to this earlier. I think that we all can use smart dollar and financial well-being in this time that we're going through right now. And they will also help you figure out just little steps to save better. Ways to quit tobacco. Another great program that will help you figure out how to stop smoking, which is so important these days because it leads to other health conditions. So that looks like that's the end of our presentation. Jamie, do we want to open it up for questions?
Yes, thank you, Michelle. There is a question in the chat. I will read it. Is Johns Hopkins going to be out of the network as of next year?
Good question, and I should have addressed that. We are working, actually, this is to the attention of our executive staff. They work every other day with Johns Hopkins to try to keep them in our network. So we don't want to lose them, and I don't want to lose them either. My mother's doctors through Johns Hopkins. So it's personal to everyone. So we are working with Johns Hopkins through negotiations to keep them in the network, because we definitely do not want to lose them. So we will keep Jamie and team informed once they've reached that decision. I'm sure that everyone will be sending out emails to make sure that you guys know that they're still in the network.
Hey, Michelle, it looks like we have a special guest, Ozzy with CloseKnit, and he has a few slides
Oh,
as
Ozzy,
well before we lose anyone.
Yes, I'm sorry, Ozzy. I'm so sorry. I didn't have everyone open, so I couldn't see everyone. Everyone, this is Ozzy Torres. He's with CloseKnit to talk about another primary care solution for you. So Ozzy, go for it.
Great. Let me grab the screen here.
And I'm going to stop sharing.
Perfect.
And you can begin.
Awesome.
And so while Ozzy pulls up his screen, this is a resource offered through Carefirst. So I will turn it over to you, Ozzy.
Great. I want to make sure you guys are seeing the title slide there.
Yeah, we can see.
Yes.
Awesome. All right. Well, I want to say thank you for having me. My name is Ozzy Torres. I'm the marketing manager here at CloseKnit, and I'm really excited to talk to you about CloseKnit. If there's one takeaway that you get from today, it's that we're a new type of primary care practice, one that you can access from your mobile device. We're here 24/7, wherever and whenever it's most convenient to you, and it's free to join. And chat with your care team is also free, so you should give us a try. So that's the quick 30-second pitch. I know it's close to the end of the day here, so I'll try to keep it short. But officially, right, CloseKnit is an advanced virtual primary care practice. That can be a mouthful, but what it means is that we focus on a few things. We focus on providing access to high quality care. We focus on providing convenience around what can be a confusing system. And we we have a focus on building long-term relationships with our patients. And so we're a newer company that believes in old school values, like getting to know you and your medical history, being there when you need us, and treating you like we would want to be treated. So before we get into it, I want to show a quick video that talks a little bit more about what CloseKnit is and what we're all about. And I hope this video works. Let me know if anybody has any issues with it.
There was no audio to that, Ozzy. I don't know if there was supposed to be audio.
Oh no, yes, there was audio to that. I'm so sorry. Well, I'll walk through everything in the next slide or so, but pretty much what that video took you through was the idea that we are built around you, and so there was a lot of you in that video, and it ended with that focus on you as well. But really, what we did when we built CloseKnit was We listened to patients to hear what they had to say about the traditional primary care model, and we heard some interesting things. We heard that the appointments can be hard to make. You might have to take time off of work. You'll have to travel, maybe find childcare. Basically, you'll have to put your life on hold, or you may have to put your life on hold to get to an appointment. There's long wait times. You can get there on time and still wait 20 minutes in a waiting room, get to a room, wait another 15 to 20 minutes. And that's after you took some time to travel to the office, find parking or any other method of transportation. We heard that the lead times could be pretty long. You might not see a provider for months, and there's a lot of practices that aren't taking on new patients. And we also heard that sometimes the visits can be a little short. You can have a preventive care visit that lasts 15 minutes, and you feel like you're getting rushed out the door. So it's really not unreasonable to ask if there's a better way to do it. And what it comes down to is that today experiences across the board are getting better because of technology, and we believe that this is an area that should also improve with technology. So yeah, we heard people loud and clear, and ultimately we want people to experience close-knit and say, why hasn't it always been this easy? When somebody hasn't been in the system for a while, or it's their first time, it can really be anxiety ridden. You might not know what to do. You might not know where to go. And when you need it most, you might be in pain, or you might need a lot of help. And those things really layer on top of each other. So not only do we know that patients need help, but we also know that patients need to feel empowered. And that's our aim, to empower you. And I'll go into how we do that in a moment as well. But before we dive into everything that you get with close-knit, I want to talk to you a little bit about what our practice looks like. We're headquartered in Baltimore, but we serve all 50 states, including the District of Columbia. We're paid through insurance benefits, so that means we operate like any other practice. So if you're subject to a copay for a primary care visit, you're subject to a copay at close-knit. So just like visiting any other doctor's office. And we're an adult-only practice. So if you're a Carefirst member and are 18 or older, you are eligible for close-knit. Nobody under the age of 18, not yet. So a few things I wanted to touch on how we deliver, access to care, high-quality care, are these 8 points. First, we focus on whole health, right? Not just telehealth, not just urgent care. We help with both physical and behavioral health. We offer mental health consults with therapists. So whether it's preventive, urgent, chronic, behavioral, you can come to close-knit and we can help you. The second is that we like to think of ourselves as a one-stop shop, right? So there's so many options out there, and you can think of us as the front door or your first step to get to the help that you need. We're virtual first, not virtual only. That means that we're going to treat you virtually when we can, but if you need in-person care, we can arrange that for you. And that goes to the third point, which is care coordination and support. We know that coordinating care between specialists can be really frustrating, and our team does the legwork for you. So our care team can help with finding referrals, scheduling those appointments, making sure that that other specialist is taking on new patients. So again, doing the legwork for you. The fourth point here is we want to demystify how your benefits work, which is why we offer insurance navigation assistance. If there's a claim that comes through and you have questions about it, our team is here to help you, can explain it to you. And really, we want to educate you on how the system works so that you know exactly what to expect. Next, we're open 24/7 365. We know that, and we touched on this before, traditional primary care appointment times can be really inconvenient. We found that 7 a.m., 7 p.m. appointments seem to be hitting a need for a lot of our patients. So even if you can take time off of work, maybe you just don't want to. And so we offer appointment times that are outside of your traditional work hours, also offer appointment times during the weekends, and you can message us anytime, 24/7, 365 via chat. Next, we've got dedicated care teams. So when you register and you create your profile, you get a primary care physician assigned to you, and that's your person. You also get a team. You may or may not get a behavioral health therapist on your team as well. It depends on your needs. But you have somebody, right, your primary care provider who you can build a relationship with, because you'll be able to go back to them and see them over and over again well into the future. So that's the part of us not being a one and done practice. Next is only the best care. We've got a fully vetted credentialing process. We've got, again, providers licensed to practice in all 50 states. And what's really important to us is that we make sure that our physicians have the time that they need to build relationships with patients, right? We want everybody to feel like they have somebody who's actually listening to them. And it's really important for us that we build that into the model. And last but not least, no membership fees. It costs absolutely nothing to register for CloseKnit, to create your profile. So you can download the app, take a look, and you'll never have to pay a penny if you don't book a video visit. And when you do decide to check us out, I definitely recommend that you try messaging your care team using the chat, because chat is free. That means there's no insurance claim drop for chatting with your care team. And we've seen a lot of patients use this. They would rather talk to somebody and say, hey, it could be somebody waking up at 1 a.m. and having a thought, something that's keeping them up at night, and you can message your care team about it, and your team can help decide, what the next course of action would be. And so to wrap it up, you can register at closehealth.com/register, or you can head straight to the Google Play Store or the App Store. I've got the QR codes here, or you can just search for CloseKnit or CloseKnit Health, and you'll be able to find our app. Want to say thank you for the time, and I will hand it back over to Michelle, and happy to answer any questions as well.
Thank you. Not sure if we have any questions for Ozzy regarding CloseKnit. Thank you for that information. There was a question about the vision coverage, and I know Michelle responded in the chat. So the date, yes, the Davis Vision presentation is next week. It's scheduled for October 18th. And that session will be dedicated to the Carefirst Davis Vision benefit. So do we have any other questions before we end this session this afternoon?
I have a question.
Okay, Ms. Thomas, one sec. We have a question in the chat just popped up. What is the difference between Carefirst video visit and versus CloseKnit? Michelle, you're on mute.
Sorry about that. So the difference between Carefirst video visit and CloseKnit, you will have a personal physician that will be with you. Your primary care physician will be for you. The Carefirst video visit is more for urgent care, mental health, dietitian. CloseKnit offers you a primary care physician that will stay with you always. So that's the biggest difference. Ozzy, did you want to add anything around that?
No, I was going to say the exact same thing, right? You get your
Okay.
primary care provider that sticks with you.
Yep.
Thank you. And Ms. Thomas, you had a question? And you're on mute, Ms. Thomas.
Okay. Yes, earlier when, well, hello, everyone. You were talking about the HMO option 1.
Yes.
And then you was talking about the other one. And you said something about in-state. So you're saying that if I travel out of state and I only have that HMO option 1, that am I covered out of state or just in Maryland? That's what you're referring?
So for the HMO option 1, network of providers you're using is the Blue Choice HMO. So that's only going to be in the DC, Maryland, and Virginia area. But when you're traveling outside of DC, Maryland, and Virginia, you can use any PPO provider of your option, and you still have what we call like a network benefit, where the primary care physician copay is like 20, and I think the specialist is 35. So that is the advantage of this triple option plan, that you still will have minimal costs out of your pocket anywhere in the United States, or even if you're traveling overseas.
Oh, okay, then thank you.
You're welcome. And if you, I have to tell you, a few years ago, I was in Paris and was happy to see some Blue Cross Blue Shield providers, and they had their shingles out saying, we participate with Blue Cross and Blue Shield. So if anyone is ever traveling outside of the United States and are looking for any Blue Cross and Blue Shield participating provider, you can, one, call customer service, or go online to find a doctor and actually put in there that you are going to be in France or Italy or whatever, to see what kind of participating providers are out there. But keep in mind, most times if we're out of state, like I was just out of state traveling, normally we go or need to see a provider for medical emergency issues. So anytime, and that's the reason why on the chart it says for option 1, 2, and 3, for any emergency room, we're always going to cover that under option 1, no matter what.
Oh, okay. Oh, thank you.
You're welcome.
Thank you.
I have a quick question.
Yes, go ahead.
So if I choose a primary care physician through CloseNet, will I be issued, or will the Carefirst PCP be changed? Because whoever is listed on my card right now, will that also be updated, or is it something in parallel that we can have this CloseNet PCP option?
So Ozzy, on their identification card has their primary care physician today. If they choose a CloseNet provider, does that appear on their card?
That's a really good question. I'm not sure
That's a really
about
good
about
question, yeah.
updating the card, but I do know that you can select CloseNet as your PCP, and your actual provider, your actual CloseNet provider, would be listed. As far as how that's handled with the actual card, I'm not quite sure. So I can look into that and get back to you.
Yes.
But yeah, that's as far as selecting one. You can select CloseNet, or you can decide not to. You want to just give us a shot and not use us as your primary care provider. We can still help you that way too.
Yeah, and we will get that answer back to Jamie.
Sure. Because the reason why I'm asking that question is, sometimes for regular visits, if you see a primary care physician, you are billed differently versus regular providers. Like if you go to a primary care, it's only like $10 copay, whereas if you are seeing other than outside primary care, it's more. So
Yeah, the specialist copay is different under option 1. Yes.
Right. So in case if we choose the CloseNet and still see the primary care physician that is listed on the card, how does the billing work is my question.
So your copay is your primary care physician copay. That's not going to change. Yeah. So the copay is going to be the same because it's a primary care physician.
All right. Okay. Thank you.
You're welcome.
Good questions. Thank you, everyone.
Mm-hmm.
Any other questions before we close? All right. Well, not hearing any.
Well, I do. I know you said no personal questions, but if you do have one, is there any other person that we can speak to live other than calling the Carefirst line?
Yeah, customer service is going to be able to assist you with any type, because they have access to your claims. Like I don't.
if you wanted to call me. I don't have access to our claim system. So that's why we refer people to our customer service.
And I believe the number's on the back of the card as well.
Identification card. Yep.
Yeah.
Right, it is, but I've just been getting like conflicting answers when I'm calling about a certain question. So that's why I just wanted some clarification.
And you've called multiple times and can't get an answer to that question?
I've called multiple times, but I've gotten multiple different answers. That's why I just haven't gotten any clarification. One person I've called like 5 times and I've got 5 different answers. So I just.
Well, let me see. Sarah, is there any way that you can reach out to Ms. Thomas? Sarah, there you go.
Yes, I can do that. If somebody from the group can get me her information so I can take a look into the account before I make the call, I'd be more than happy to do that.
Thank you, Sarah. So Ms. Thomas, if you were able to get that information to one of the HR representatives, because we really apologize that you received 5 different answers. So we definitely want to be able to get that situation corrected for you.
Okay. So I can just send you my email address. Would that be possible? Or
Ms. Thomas, I just sent you a message in the chat with my email address. So just email me your information and then I'll connect you with someone at Carefirst.
thank you.
You're
And
welcome.
if you can also include in that email to Jamie a brief description of what it is that your question is. And that way Sarah's more prepared when she calls you back to be able to respond to your question.
Sure. Thank you all.
You're very welcome. All right. Well, again, thanks everyone for attending. Again, the session is recorded. We will post the recording in about 48 hours on the benefits information website. Our next information session is scheduled for tomorrow at 4:30, and that'll be the Kaiser medical plan. So feel free to log in and check that out. And again, thanks, Michelle and Ozzy, and everyone have a great night.
Thank you, everybody.
Thank you. Bye.